Escape to the action at Seminole Casino Hotel Immokalee. It is Vegas style 24/7 because just like Vegas, Seminole Casino Hotel never closes. It is pure entertainment anytime you want, and it's truly where paradise wins. Well, you can call them the most caring doctors in sight. Joining us this morning from Community Eye Center and St. Lucy's Eye Center Surgery Center again is Dr. Joseph Spadafora. Good morning, doctor.
Good morning, Carly.
So glad to have you here this morning. I'm going to brag on you guys a little bit because I think it is pretty nice for our area. You guys are celebrating your 25th anniversary, is
Correct.
that right?
25 years.
Congratulations.
Thank you.
You're doing that, by the way, with the cruise giveaway. Your office is doing that. How nice is that?
We want to make certain people realize we're there.
Yeah.
We're proud of what we do.
You are proud of what you do. We're going to talk about kind of some specialties that you're able to offer people. But if anyone's interested in learning more about you, kind of right off the top, certainly finding out more about this cruise, how they can win a cruise, how do they sign up and enter for that, doctor?
Come to one of our locations. We have 3 locations. Sign in. That's all it takes.
Yeah, easy enough. Well, again, congratulations for being open for 25 years. You guys must be doing something right. One of those things is cataract surgery.
Yes.
And it was interesting. When I first heard cataract surgery, I thought, oh, well, it's mainly people, with elderly people. But you were saying this actually can happen to kind of anybody that might be in need of cataract surgery, correct?
Yes, it does. Overall, in the worldwide, we have over 245 million people who need cataract surgery of the 7 billion. In our own area, we have a higher percentage of people requiring cataract surgery. I've done a number of 17-year-olds and 18-year-olds in the last 6 months because of steroid exposures, various medications, or autoimmune conditions requiring other medications, which cause problems.
Well, and talk a little bit about your office and what you guys are doing a little bit differently when it comes to cataract surgery. There is a special machine that you are able to use that you guys I know are very proud of, and something I know that you are pretty excited about to offer Southwest Florida.
Yes, there's 345 of these Aura machines available. They're laser aberrometers. What they do is at the time of cataract surgery, we remove the cataract, and then we measure the eye at that time without the cataract in place. Then even the incision we make alters the effect of the lens calculation, so that we can choose a better power lens for the patient and give them the best outcome.
Well, I was going to say, what are the, for someone who may be, having to have cataract surgery in their near future, what's the benefit of being able to come to your office and have, your doctors be using this machine? What's the benefit for them?
Well, think of it this way. A surgical procedure like cataract surgery is for the rest of one's life. It is not a simple one-time event and then 5 years later, I want a new car, I get a new car. This is I have surgery, it's going to last me the rest of my life. It's most important to get the most accurate reading now, because it's going to last you a long time.
So is that what it is? It gives you, when you're in the middle of surgery and in the middle of what you need, it's that most accurate because of the laser technology? Is that correct?
Laser aberrometers, the best thing there is.
Wow. How has cataract surgery changed over the last, how many years have you guys been able to do cataract surgery? And certainly I'm interested about the change in the last 20 years.
Well, cataract surgery has been exciting. The procedure, the small incision surgery, was actually invented by Dr. Charlie Kellman in 1977. And then the technology, the equipment gets better all the time. The surgeons of 100 years ago were just as dedicated as today, but technology's improved. We try to be on top of what is appropriate and what is best technology for the patients.
Yeah. So if someone is watching this morning, they're interested about cataract surgery, maybe they have a few questions to ask, what should they be thinking about and those things that they should make sure they have in order?
Well, the big picture is what kind of history are you an engineer? Are you a nurse? What are your activities? What are your hobbies nowadays? I'm no longer working as an engineer, but I have the mindset of an engineer. Or as a person who's a golfer, they want to be able to see the distance, the pin, as well as the golf club. So there's going to be a different lens for that individual. If you simply sit home and read all the time, nothing wrong with that, but you have a separate, outcome, separate requirements. If you're a knitter, that's a big deal also.
Yeah. What is the best thing to do to find out if you are a candidate for this, to figure out what kind of lens that you might, want or need? What's the best way to do to find out more about your office, find out more about you?
You come into the office, get an hour for an examination. You want to be seen, we're there for you. We have a questionnaire of significance, trying to look at what you have done in the past, even as much as your national heritage, because certain activities are different. Yes, it's quite exciting, quite interesting that way.
Yeah. Well, and talk about, is there any red flags or anything that people should maybe be looking out for that they may have an issue with their cataract? What are the biggest signs and symptoms?
The most common thing I see is at nighttime they lose their depth perception.
Okay.
If there's cataract in one eye, the other eye is not that bad. Daytime, they have other clues on the side of the road to say, I can drive. But at nighttime, they look at the tail light ahead of them. Is that car 10 feet or 15 feet away? Ooh, it's closer than I thought. When people experience that, that's the first sign of a issue.
Is it normally just in one eye, or will it be common
Usually
to...
both eyes, but the first eye has to develop.
Okay.
And people notice that asymmetry.
Yeah.
If both eyes develop cataracts at the same rate, one eye being nearsighted, one eye being distant, because of cataract change, requires surgery sooner.
Yeah.
But if they both go at the same rate, they can postpone surgery.
We have just about 30 seconds left. Is there anything else you think that people, watching this morning should really understand, number one, about your office, or number two, about cataract surgery and this laser technology that you're able to use?
Well, the thing is, we have a team approach at our facility. Dr. Scheibel is my partner. We have oculoplastics available. We have retina specialists. We have two excellent optometrists. We're top of the line. We actually have patients coming from Naples, Sebring. I have relatives who come specifically for surgery at our facility from Spain, from Italy, and from India.
Wow. So even though it may take a couple extra minutes to drive, it's definitely worth it. Doctor, thank you so much for joining us this morning. I learned a lot this morning. We look forward to having you back.
Thank you very much.
Thank you. All right, coming up, it's our racing trivia question of the day, how you can win tickets to 2 races at Daytona. Keep watching to win. But first, we go from your eyes to your teeth. Meet the dentist who can make your smile shine brighter than ever. Stay with us.